Have you ever wondered how some women discover they have breast cancer early enough to fight it effectively? Well, the answer lies in the power of awareness and vigilance. Welcome to our comprehensive guide on the early warning signs of breast cancer. Breast cancer is a formidable foe, but it's not invincible. Early detection is a game changer, drastically increasing the chances of successful treatment. By the end of this video, you'll be equipped with the knowledge to identify these early warning signs, giving you the upper hand in this battle. We'll delve into signs such as a new lump in the breast or armpit, changes in breast size or shape, skin changes on the breast, nipple changes or discharge, and persistent pain in the breast. Remember, knowledge is power, and in this case, it can be life-saving. Knowing the early warning signs of breast cancer could potentially save your life or the life of someone you love. The first early warning sign we're going to talk about is the appearance of a new lump in the breast or underarm. These lumps often feel different than the surrounding tissue. They might be hard, have uneven edges, or could be tender to touch. But don't panic. They might not always be painful or even noticeable without a thorough check. That's why it's crucial to make regular self-examinations a part of your routine. It's not uncommon to feel lumps or bumps in the breast or armpit area, especially during certain times of the month, as hormones can make the breast tissue feel thicker or fuller. Yet, if you notice a lump that feels distinctly different, doesn't change or go away, it's important to consult a healthcare professional. Remember, not all lumps are cancerous, but it's always vital to get any new lump checked out by a healthcare professional. The second sign you should be aware of is any unexplained changes in the size or shape of your breast. This can include noticeable swelling, shrinkage, or alterations in the contour of the breast. It's not uncommon for your breasts to fluctuate in size due to hormonal changes throughout your menstrual cycle. However, if these changes persist beyond your cycle, it could be a cause for concern. Sometimes the changes may be subtle, such as slight dimpling or puckering of the skin, or perhaps one breast appears slightly different from the other. It's important to remember that each person's breasts are unique and may not be perfectly symmetrical, but any new asymmetry should be checked out. Also, an inverted nipple or changes in the direction the nipple points could signal a problem within the breast tissue. Again, changes in size or shape are not always indicative of cancer, but it's best to consult with a healthcare provider if you notice any changes. Another sign to watch out for is any changes in the skin of your breast. The skin is our largest organ, and it can often be the first to show signs if something is amiss. Changes to the skin on your breast can range from subtle to more noticeable. This could mean a new redness or warmth, the appearance of dimpling, almost like an orange peel, or even a rash that doesn't seem to go away. The key here is familiarity. Knowing what your breasts normally look and feel like can make it easier to spot these changes. Regular self-examinations can be a helpful tool in this. However, remember that not all changes mean something sinister, but it's always better to be safe than sorry. So if you notice any new or unusual changes, it's important to seek medical advice promptly. Your skin can tell you a lot about what's going on inside your body, so don't ignore any changes. The fourth warning sign is any changes to your nipple or any unusual discharge. The nipple is an often overlooked area, but it can provide important clues about your breast health. If you notice your nipples becoming inverted or indented where they weren't before, it's time to take note. This could potentially be an early sign of breast cancer. Equally important to keep an eye on is the presence of any unusual discharge from your nipples. While it's normal for women who are breastfeeding to have some discharge, clear or bloody discharge at any other time is not typical. This could be a symptom of a benign condition or, in some cases, breast cancer. Remember, these changes don't automatically mean you have breast cancer. However, it's crucially important to not ignore these signs. Your body is your first line of defense, and it communicates with you through these signs. Any changes to the nipple or unusual discharge should be checked by a healthcare professional without delay. The final early warning sign of breast cancer we're discussing today is persistent pain in your breast. Now, it's not uncommon for your breast to feel a bit tender or to ache a bit around your period. This is usually nothing to worry about and is a normal part of the menstrual cycle. However, if you notice a persistent pain in your breast that doesn't seem to be related to your period, or a pain that doesn't go away after your period, it's important to get it checked out. This pain could be sharp, it could be a dull ache, or it might even feel like a tight, heavy sensation. It's crucial to remember that breast pain doesn't necessarily mean you have breast cancer. There are many other possible causes. But persistent pain is your body's way of telling you something isn't right. Don't ignore it. To recap, the 5 early warning signs of breast cancer we've discussed are a new lump in the breast or armpit, changes in the size or shape of the breast, skin changes on the breast, nipple changes or discharge, and persistent pain in the breast. These signs can vary in presentation and may not always indicate cancer. However, their presence should prompt you to seek immediate medical attention. It's essential to always be in tune with your body, recognizing and responding to any changes promptly. Early detection plays a pivotal role in the fight against breast cancer. When detected early, treatment is often more effective, and survival rates are significantly higher. Therefore, regular self-examinations and scheduled mammograms are crucial. If you notice any of these signs, please consult with a healthcare professional as soon as possible. Don't let fear or uncertainty delay you. Stay vigilant, stay informed, and remember, early detection is the key to fighting breast cancer effectively.